Alrighty, I'm going to enter the patient's room now to scan their ID band and get their medications to come up on the MAR. Hi, I'm Megan Geary. I'll be your nurse today. Can you state your name and date of birth?
Annie Jackson, April 10th, 1976.
Excellent. I'm going to scan her ID band to see her medications. I'll be back in a moment. So alright, so to start, I'm going to look, and she has omeprazole, and we're going to give her metoprolol right now. And she has 100 milligrams PO daily. So I'm going to reach in her medication jar for the first check. Metoprolol 100 milligrams daily. So this is the correct dose, but if it wasn't, I would use dimensional analysis. If there was a 25 milligram pill available, I would use 4 of them to get the 100 dosage that we need. And she also has an order for insulin, regular acting, and MPH. So the MPH is the long-lasting insulin, and she has 10 units subcutaneous twice a daily from a 100-unit vial. So I look. First check. The NPH, 100 units. This is the correct dose, so that's the first check for that. And you'd roll this in your hands before giving it. She also has an order of sliding scale insulin for regular, and that is 10 units, no, it's 100 units per mil, regular human acting insulin. So I check. So the first check for that, insulin, regular human, 100 units per mil. And that's on a sliding scale, and her blood sugar today was
190.
190, so she would get 2 units of regular acting insulin. Awesome, so that's the first check against the MAR. Now we are going to draw up our insulin. No, now we're going to look and see that she has a hepatitis B vaccine that she needs, and it says it's a 20 microgram vial for 0.5 mil intramuscular. So we look, hepatitis B vaccine, 20 micrograms, 0.5 mil, that's the first check for that, and that's our intramuscular injection. So we are going to start by swabbing each of the vial caps using a different fresh alcohol swab for 30 seconds. 30 seconds. Seconds. And we're going to start by drawing up the insulin. So for NPH, she needs 10 units of NPH insulin. So we're going to roll that first in our hands, and then open the insulin syringe. Being careful not to contaminate the needle. You set it down for the scoop method, and you're going to inject 10 units of air into the NPH first. Then you're going to inject the 2 units of regular human insulin into regular acting insulin.
Oh yeah, we need all IV stuff again, right?
And then you're going to draw up the 2 units of the clear, because clear before cloudy, making sure you don't have any air bubbles. Then you're going to draw up the 10 of the NPH.
You have a tourniquet, right? Yep.
Totaling 12
Sorry.
units.
Just videotaping.
And you're going to swoop it closed without contaminating the needle. For the second check, you're going to make your label. And on the label, you include the client's name, the medication. So the client's name is Annie Jackson. The medication is NPH insulin and regular. And for the NPH insulin, it's the 10 units. And for the regular acting sliding scale, it's 2 units. And you initial it MG. So that's the second check for the insulin. Now you're going to draw up your hepatitis B vaccine. And she gets 0.5 mils. So you're going to inject air first into the vial to create the suction. And then you're going to drop 0.5 mils, making sure you don't have any air bubbles. Excellent. So there's 0.5 mils of that. And you're going to recap that. Okay. You're going to do a second check of the hepatitis B vaccine. We drew up 0.5 mils. It says 0.5 mils in the MAR. So we're going to make the label, and that is our second check for the hepatitis B. Client's name is Annie Jackson. Medication is hepatitis B vaccine. Dose 0.5 mils intramuscular, and initials is MG. So now we are ready to enter the patient's room with our medications. So, hi, I'm Megan Geary. I'll be your nurse today. Can you state your name and date of birth?
Annie Jackson, April 10th, 1976.
Awesome. Do you have any allergies?
Yes, to Toradol.
And you're going to hand sanitize. And before you give your oral med, you're going to triple check it against the MAR. And it says metoprolol 100 milligrams PO, which is what it says in the MAR. And then you will scan your med at the patient's bedside before you give it. I'll provide a drink.
Yes.
And I'll tell her metoprolol is an anti-hypertensive and it prevents against myocardial infarction or heart attack. So now that that's given, I'm going to start by giving her insulin. And we have done the triple check against the MAR, and we've scanned it. You scan the NPH, and you scan the regular. And you're going to start by putting on gloves and cleaning the area for a subcutaneous injection. And since it's insulin, you're going to give it into the abdomen or the back of the arm. You're going to clean the area for 15 seconds or more, circling outward, and you wait for the area to dry before injecting. With the subcutaneous injection, you always want to make sure it's bevel side up, and it's at a 45-degree angle. So you can see 45-degree angle. Inject it. Tell her there's long-lasting and short-acting insulin. Before pulling the needle out, you make sure you have gauze prepared to apply pressure. You cap your needle, and you dispose of it in the sharps container. Next, you explain the hepatitis B vaccine, and you give her a sheet on the vaccine and let her know what's in it and possible side effects that could occur. And this is an intramuscular injection, so you'll shoot it like a dart at 90-degree angle. You're going to re-clean the area, and we're going to use the deltoid for our anatomical site, which is 3 fingers down from the acromion process. And then you make a T like this, and that's the deltoid spot. So once the area is dry, you're going to uncap the needle and inject it at a 90-degree angle like a dart. You will also apply pressure to the area after administering the injection and recapping your needle. If we didn't want to use the deltoid, we'd use the dorsal gluteal, the ventrogluteal, and the vastus lateralis are also possible options for intramuscular. You throw away your waste, and you dispose of your needle in the sharps container, and you check documentation that the hepatitis B vaccine was given, the insulin, MPH, and regular was given, and that the metoprolol was given on the MAR. You leave the patient's bedside and come back and check for any allergies or alleviating factors from the medication you just gave.